Everything that I got is just what I got on.
Bob Line is singing with a new voice today thanks to Dr. Mary Es Beaver.
And then
But you were able to talk right now.
That's right, yes, not like I used to, right.
Good.
She's the director of the Texas Center for Voice and Swallowing, a division of Texas Ear, Nose, and Throat Specialists. Dr. Beaver is a laryngologist, which means she is an otolaryngologist who specializes in disorders of the voice and throat. Having completed a post-residency fellowship in laryngology, Dr. Beaver is highly qualified to treat problems such as hoarseness, reflux, chronic cough, trouble swallowing, vocal cord spasm or paralysis, and upper airway problems.
Sometimes you need more specialized equipment to view the vocal cords and see the specific vibrations of both vocal cords and how they move. And we have special equipment that will allow us to have a real detailed look at the vocal cords and detect diseases that normal doctors and normal ear, nose, and throat doctors cannot see.
Bob was referred to Dr. Beaver after visiting his regular otolaryngologist at Texas ENT Specialist. He had noticed that when he was singing, he couldn't hit his high notes. To top it off, his voice was often weak and hoarse. It was affecting his job in sales.
People would say, are you hoarse, or are you sick? You know, because the one thing about when you're in sales, if you go to an office and they think you're sick, they don't really want to see you. They want to go like, okay, you need to go home or get out of our office. I don't want to get sick. I'd say, I'm not sick, you know. So yeah, it kind of affected my sales a little bit.
The voice is your instrument. The voice is the way that you represent yourself to the world around you. So when there is a medical or surgical problem with the voice, it really robs a patient of their ability to express themselves, whether that's professionally or personally. Giving that back to them and helping them to recover and move on from that is one of the most gratifying things that I can do.
Dr. Beaver determined Bob had reoccurring polyps on his larynx. Through outpatient surgery and medicine, Dr. Beaver was able to restore his voice. Bob's clients can now hear him clearly.
For a while on the telephone, I'd call them before I had the surgeries, and they didn't know who I was, which was kind of disturbing, you know. They would say, who is this? And I'd say, Bob. And they go, oh, you don't sound like yourself, you know. And I always hated that, but now they know exactly.
Dr. Beaver uses specialized diagnostic equipment like this to show patients their vocal cords and problems. She often performs surgery under a microscope to fix the very small vocal folds. Patient Patty Williamson came to Dr. Beaver with a hoarse voice. As an elementary school PE teacher, she struggled to talk to the children.
Sometimes I would be in the middle of a lesson and my voice would go completely out.
Now just 4 weeks after surgery, Patty says she feels and sounds better than she has in years. Her experience with the Texas Center for Voice and Swallowing exceeded her expectations.
They called me after the surgery, make sure that I was doing okay, so I got a personal phone call. I thought that was very, very good customer service.
One of the things I think is a real tragedy is when patients see numerous physicians and they are told over and over that there's nothing that can be done for them. So it's really nice to be in a large practice to be able to reach patients quickly and be able to help them with their disorders of their vocal cords.
Dr. Beaver's specialized training allows her to treat the most complex vocal problems. Through her years in practice, she's treated the voices of many well-known singers and actors. She truly works miracles for some of her patients.
So giving someone their voice back is one of the greatest joys for me. And one particular story stands out before Christmas time where a patient who had a paralyzed vocal cord could not speak at all. And after the surgery, he came in right before Christmas and I said, "How are you doing?" And he said, "Oh, I'm doing fine, doctor." And I said, "That's really funny." And he said, "I'm doing great." And so it was really fun to give him that as his Christmas present.
Your voice is the key to communicating with others. You shouldn't struggle to speak. You shouldn't have difficulty swallowing. And you shouldn't be shuffled from doctor to doctor trying to diagnose your problem. Come visit Dr. Beaver and our staff. Let us find the answers to your problems. Take the first step and give us a call. We look forward to seeing you soon.